hospitals are closing every day, and especially in the rural parts of Kenya, hospitals are closing. Workers have gone for 3 months or more without salaries. Auctioneers are at the doors of hospitals. Most of the hospitals where our people are visiting in rural areas, whether they are public hospitals or they are private hospitals, don't have drugs, don't have essential commodities. The hospitals are now in a dire situation, and this has come as a result of two of the largest insurance providers in Kenya. One, the National Hospital Insurance Fund, and two, the consortium of CIC, Old Mutual, and Britam that is in charge of the police medical scheme. They are not paying hospitals. You have seen in the recent media briefings, the situation at NHIF is at critical moment. We are in crisis. NHIF today, as we are talking, cumulatively has not paid medical providers 15 billion shillings. This is the amount of money which Kenyans are paying through contributions. But when they come to hospital, they are asking, why is it that they are not getting the services that they deserve? And we have a simple answer for Kenyans today. The answer is that both NHIF and the police schemes are not remitting money to your service providers. Therefore, because all our attempts to solve this matter in an amicable manner have failed, we are activating clause 2.13 of our contract with NHIF, which talks about top-up payment. It says that for any uncovered medical claims, on consent, the hospital may request the beneficiary to top up payment. From 1st of May, if these claims are not settled, the contract is very clear, they must be settled within 90 days. Today, we are talking 6 months, we are talking 8 months. We are for Linda Mama, we are talking since 2019, claims have not been paid. If these are not settled within the next 10 days, we have no option. In order for us to keep hospitals open, we have now to start asking Kenyans to go into their pockets so that we can be able to pay our workers, so that we can be able to buy drugs, so that when you go to hospital, you can be guaranteed that you will come out safely. In the meantime, we remain committed as RUPHA and as private sector to offer you the best healthcare possible. But we need the support of NHIF, we need the support of CIC, Britam, and Old Mutual. Please release the money that you owe hospitals. Today, we are aware that government of Kenya has not remitted to NHIF 24 billion shillings through these various schemes that are run by government. We are appealing to the government, as you budget for this next financial cycle, please release money to NHIF so that hospitals can get money, so that patients can start receiving the medical care they deserve, whether it is in private hospitals or in public hospitals. Since 31st of January, as an association, we have written numerous letters to NHIF requesting for a sit-down to discuss the issue of payments. In fact, as late as this week, we have been trying to reach out to the CEO's office and saying, please, let us sit down to talk. So as an association, we still remain committed to talks. Even today, if we are called, we will talk. But what we want them to do is to prioritize. Kuna malipo mengi ambayo wanahitaji kufanya. We know there are maybe patients who want to go abroad. Maybe you want to prioritize payments to certain, say, large providers. Lakini sisi watu wa mashinani tunaumia. Sisi watu wa mashinani, zile hospitali ndogo ndogo ambazo kina mama zetu, babu zetu, our people in the villages where they go, hizo hospitali hazipati fedha. And we are asking, tunaomba ya kwamba priority ipewe malipo kwa hospitali za mashinani.